It's a
No.
different case.
Oh, is it? Oh, I'm so sorry. I didn't know that. Oops. Let's see. Okay. If someone else wants to start talking about what their concerns are, I am so sorry. I did not know that.
That's okay.
Absolutely no worries.
Let's see.
I'm trying to find a way to just pop the case in the chat here, but I'm struggling with that. There it is, attachments. Here we go. I'm going to put it in the chat, Ezra.
Okay, I'm going to stop screen sharing for just a second. Did you send it? I'm having a hard time seeing it.
It just went through.
Okay, cool. Okay. I'll just.
And you'll see my highlights in there too.
Gotcha. Okay, if someone else wants to kind of
those.
Yeah, if someone else kind of wants to take the lead, I'm so sorry.
Okay.
I can start with my concerns if that's okay.
Yeah, go right ahead.
Okay. Are you still writing, or should I write like I have it?
I can do both at the same time.
Are you sure?
Yeah.
Okay, sorry.
That's okay.
Ezra, I can share my problem list with you too, because that might help you to kind of streamline. Some of these things are going to be more med things, but I did also put the social stuff online and some possible social work recommendations. So I'm going to just pop my Google Doc in the chat here. That's my just personal notes on it.
Cool.
Let me know if you don't understand any of my very medical abbreviations in this document.
Okay. Okay. I will open that as well real quick, and then I can write down what Jackie's got. Here, I can share my screen again. Okay, there we go. Alrighty. So Jackie, do you want to give some of your concerns and I'll write them down?
Yes. So, one of my concerns was pain in regards to the osteoarthritis and the left knee pain that they're having and that they're experiencing. Even their toothaches, they talked about how they had pain in those areas. And then for some recommendations, I put pain self-management strategies, like modalities like hot and cold packs, self-massages, using positioning devices. What else? A pain journal, and then if they need to use adaptive equipment to compensate for the pain, I would teach them how to use that.
Awesome.
And then I also was concerned about their obesity.
Mm-hmm.
And would recommend making smaller changes to their diet instead of drastic ones.
Mm-hmm.
Like, sorry, I just lost my. Like adding a vegetable for the day, using portion control like visual aids, making like healthy junk food like alternative swaps, like depending on their diet, or like promoting like apps for like healthy recipes like Pinterest, and also like going on daily walks or stretching. I talked about doing a short duration home exercise program with like YouTube and like stuff like that, like just to break up the day. There's like blogs and stuff too. for resources. And then my last concern was their like possible depression or like their low mood, being disengaged and stuff that like normally brings them joy, and then like that impacting their sleep. For recommendations, I talked about using a sleep journal, learning deep breathing and like relaxation strategies to fall asleep, or even like turning off their TV an hour before they go to bed, or learning like energy conservation techniques throughout the day to enhance their sleep and reduce their fatigue.
That's great. Yeah. I hope that this will keep everything and show them everything, even though when I kind of click off of it, it's just like that.
Yeah, it's populating every window.
Yeah. I have
Well,
it too.
that I can delete. I'm just hoping that, oh. Well,
Yes, it looks like there's some sort of a macro in there where it's filling everything.
Okay, that's not good. Let me
So maybe
just use a different document.
I can always send that to you as well, like what I was just listing
Yeah,
off.
if you want to like write that down and I'll paste it in.
Yes. Yeah.
I'll make my I'll use this document instead.
Okay.
And I think that Jackie, some of your concerns are pretty multidisciplinary too, like especially the obesity and the diet and exercise stuff. I think that really touches all of our disciplines. You know, there's definitely a social work component to it in the sense that the patient has concerns about affordability of fruits and veggies. And there's also definitely a medical tie-in where, you know, that's going to be a big part of the management of their hypertension and diabetes as well.
Absolutely.
So I don't know who we want to lead that conversation. I'd be fine with either of you guys starting it, and then we can kind of touch on it in medicine later if, you know, if there's anything else that needs to tie in.
Yeah. See. Sorry, I just want to make sure I'm getting everyone's names and majors right. Okay. I'm just going to fill in a couple things that I'm thinking so far, but if one of you guys wants to go next, we can kind of just get everything out on paper and then decide like in what order we're going to go.
Yeah, I can go next, I guess. So I mean, and Megan, you and I can kind of decide who wants to do what. I know we kind of started to talk about that a minute ago. But I think kind of the big medical issues that I see are the type 2 diabetes is there's some work to do to control the diabetes for this patient. They've got some signs of early kidney problems that are likely related to the diabetes. They're on a couple of medications, but I think, you know, we definitely need to consider making some medication changes. And I think there's some additional non-medication checks and maintenance that we could talk about with the patient. And then I think the other two big medical things are the hypertension and the dyslipidemia, the high cholesterol. So I don't know, Megan, if you have a preference of which one you want to do.
I mean, no, I guess I can take hypertension. One of the major things I noticed about that specifically is the missed doses per month. I think just from even not a strictly medical sense, there's things we can kind of suggest and ideas to play around, like, why are you missing the doses? Is there any way we can kind of alleviate that? Maybe put the medication near the toothbrush or something that where you see it often, it's just a forgetting the medicine issue. Just kind of lifestyle changes.
For sure. And also wondering if, because the patient does have financial concerns, if there may be a financial component to that. With the number of doses they're missing, I kind of think maybe not, but
it's always
worth asking.
Mhm.
Yeah.
Cool. So I can kind of tackle the diabetes. I'll talk about one thing that I kind of had a question about that I'd like to ask the patient is they did have this recent fall. And I'm wondering, it doesn't say anything in their diabetic regimen whether they're doing any foot checks. And so I'm almost wondering if there may be some neuropathy where, maybe they fell when they were standing up because they were having sensory issues with their feet. So I think I want to ask about that and recommend a foot care regimen. And then also I think I'll be recommending some medication changes and, talking about, Megan, you and I can kind of talk about some of the intersection of the hypertension with the diabetes too. Because definitely those things are connected, especially with regard to the kidney problems.
Yeah. Do you know what sort of medication changes you're thinking right now?
Yeah. And I put this in the little doc. So she's on metformin and a DPP-4 inhibitor. And I found this great article on PubMed that really is like a meta-analysis breaking down adding like a triple therapy for type 2 diabetes. And because of the obesity, I think we should add a GLP-1 analog because that would potentially also promote some weight loss. And it's GLP-1 analogs tended to, in this study that I was looking at, produce the biggest reduction in the A1C also when in combination with metformin and DPP-1 inhibitor or DPP-4 inhibitor.
Okay, that'd be great.
So yeah, that's what I'm thinking.
Yeah, that makes sense.
I'm just wondering, is there any indication or need to be concerned about like any medication changes affecting some of the other things that they're experiencing, like mood or sleep or anything like that?
I mean, I think the two medication changes that occurred to me was adding a thiazide diuretic for the hypertension. Well, I guess three, increasing the statin dose, and adding a GLP-1 analog, and none of those would really affect the sleep.
Okay.
And they're not really, the side effects for all of those are they're not really going to affect sleep or mood very much.
Mm-hmm.
I think the biggest side effect is a desirable one, which is weight loss. So,
which would probably help with a lot of the secondary issues.
Yeah. Ezra, I think the other thing that jumped out as me as a social work opportunity is that the patient doesn't have any advance directive.
Okay.
So I think that having that conversation of as far as like what happens if you're not able to make your own medical decisions, that probably is more in your wheelhouse than anybody else's.
Yeah. So with that, if someone's like not able to make their own medical decisions, the social work like usual course of events is like having a trusted person in their life, be that like a guardian or a spouse, or a child or something like that. Also be in on the like giving consent practice. Obviously we have to ensure that it's going to be a person that is like reliable and has the patient's best interests in mind, because like we don't want that consent being like abused in some way or something like that. So yeah, that's something that can be like negotiated with the family, I think. So if they don't have the advance directive, it can be like something that is talked about with them as well as the family in case something happens that leaves them like incapacitated. So like, I'll say definitely discussing advance directive and desires in case patient is incapacitated. Let's see.
And I think the thing would be like, to encourage them to get a legal document established, however they need to do that so that, just planning ahead.
Mm-hmm. Let me see. And yeah, so you said some issues about like the affordability of like being able to afford healthy foods or possibly being able to afford like a um some sort of like exercise program or something like that. And that's something that we can definitely help with because like different agencies have different things going on of like where they might have like a food pantry or some agencies have like free exercise classes or something like that. So I'm gonna say possibly like taking advantage of local agency resources for food and exercise affordability. And then I also just want to ask about like the possible depression and not feeling interested in what they once were. So like getting a grasp of like how long that's been happening. Um, and if they feel like it's affecting their ability to like perform their ADLs and stuff like that. Because if so, that would likely be an indicator that therapy might be a good idea. So I'm going to say getting a grasp on how the depression is impacting daily life. I'll say depression question mark. Yeah, so I think along with Jackie talking about OT and sleep a little bit, I also have some concerns about sleep, but I don't think it's going to be like it once I talk about all these things, I think Jackie can kind of cover sleep, and if I have anything, I can just add it in, if that makes sense.
Yeah. So I think we talked about who's going to cover most of this. The only thing I'm not clear on is who's going to lead the conversation about the exercise routine. Is that going to be Jackie or Ezra?
I think it would probably be more Jackie, if that's okay.
Yeah.
I can just talk about like opportunities in the community for like exercise to happen, and she can talk a little bit more about like what specifically that exercise should be, if that makes sense.
And then I
Alrighty.
have one other note here, which is the patient recently had COVID. So I think that we probably, and this might be more of Megan and I think we should probably check in on how they're doing with recovery, since in this scenario, it was just a little over a month ago that they were sick. So I think, I don't know, Megan, whether you want to do this or you want me to, but I think we should just ask about any lingering symptoms or changes in overall health.
How they're feeling, kind of, if anyone else in the household or nearby was also infected, so things like that.
Yeah,
if they got any treatment for it as well, since that's also
and I'm honestly mostly worried about like long COVID for this patient because they do have a lot of comorbidities. So I don't know if it kind of fits in with both hypertension and diabetes. So I'm not sure if you want to ask or you want me to.
Yeah, I think if it comes up naturally in your conversation, because I figure we'll also kind of let the patient guide the conversation a bit about what's their most pressing concern, address those, and then touch on things that last for us that we also want to address.
Yeah, sounds good. Megan, is there anything else you want me to add to your section?
I mean, I have a lot of the similar concerns as Hannah, where it was like hypertension, dyslipidemia, type 2 diabetes. Also, the potential mood issues stuck out to me just because, again, as you mentioned, therapy would be a great alternative to that. Looking through it again, I think, like we said, if the diet and exercise conversation needs to come up again, I think that would be a great way to address some of these issues and at least work in tandem with the medication suggestions we're making.
Yeah.
For recommendations, I had the exact same thing as what Hannah said earlier about the increasing the statin and then the thiazide, just to kind of help tackle some of that, the increased BP that we're seeing. Other than that, I'm really interested to see what the patient is going to say is their primary concern and things like that. It might be the fall, in which case I totally agree we should look into the diabetic neuropathy. If that isn't the case, also just kind of some fall safety things, since the patient, I believe, is 63.
Yeah, that looks right.
So like
Or
a fall
73.
reduction discussion, things they can do, like do you have carpeted stairs? Are they wooden? Things like that can make a difference with fall reduction.
Yeah, that's
And
great.
then as far as like order, I know Ezra's going to kick things off.
Yeah, so I'll just
I'm
say,
happy to kind of go last and wrap it up if that
okay.
works out for people.
Agenda.
Pronouns.
Oh yeah, that's great. Thank you. And agenda for meeting. Discuss some work. Okay. Does anyone have any like particular want to go after that?
I can go after.
Okay, was that Jackie?
Yes.
Okay, sorry, my screen didn't light up to say who was talking for a second. So then you're going to talk about obviously OT concerns. Is there anything else specific you want me to put down for what your role is going to be?
I guess I'm just gonna be addressing like the concerns that I was talking about earlier, and then giving recommendations, and yeah, basically just about the pain, um, the physical changes with like their lifestyle regarding like their diet and exercise, and then like their promoting like a more balanced life in regards to like their leisure activities and productivity, and yeah, basically no.
Okay, sounds
Yeah,
good.
what I said earlier, basically.
So then do we want to have Megan and then Hannah?
I think that works, yeah.
Okay.
So I'll be mainly dealing with the hypertension, starting that conversation, discussing missed dosage, any barriers they find to accessing medication or taking it and remembering to, as well as potential medication changes with that. And then possibly jumping into just a brief touch in on, I saw you were recently diagnosed with COVID, any lingering symptoms from that, kind of getting a little bit of the history of that as well.
Alrighty, sounds good. And then Hannah, to wrap things up, what do you want me to put for you?
Yeah, so I'm going to focus primarily on management of the diabetes. I'm going to have the patient kind of give me an update on how they think the management is going, and let that kind of guide the conversation as far as what recommendations we're going to start off with. I'm going to focus my recommendations on some medication changes, as well as how some of these other recommendations that you all will have made, such as the exercise and diet, can also affect the diabetes. And then depending on what the patient has to say about their recent fall, we might talk about doing some foot checks, and definitely going to talk about the kidney numbers as well in the labs.
Alrighty. Let me look at this agenda one last time. So it kind of has the last thing, 3 to 5 biggest concerns. I think we've kind of identified those anyway, but I'll just write hypertension, diabetes,
I think obesity I don't love using obesity on its own. I think diet and exercise is more of a accurate descriptor of the management, but I think that's a pretty big one because that's going to hit a lot of other things here.
Mm-hmm. Okay. Does that look accurate to everyone?
Yeah, I would almost make diet and exercise a separate
Okay.
thing from diabetes, just because it's not. It is tied to the diabetes, but it's also tied to other stuff too.
Gotcha.
If we're limited to 5, we could probably cut previous COVID.
Yeah.
Okay.
But I think just given the case study, they're probably not going to have many extra things. I could be wrong, which we'll find out. But
Okay. So I'm gonna stop sharing real quick. Let me just I'm just going to quickly read everything over one more time just to make sure that we're all set, and then we can probably get started soon.
We have 30 minutes for the encounter and you've used 32 for your discussion.
Oh, okay.
We need to.
Yeah, we need to get going.
Okay, we can do that. Alrighty, we're about ready to get started then. So I'm going to start the meeting. My name is Ezra Mitchell and I am a social work student. It's lovely to meet you. My pronouns are they, them. Can I ask your pronouns, please?
Sure, she, her.
Wonderful. And if you could just confirm your full name and date of birth for me.
Yes, Courtney Grimes, and date of birth is February 2nd, 1960.
Fantastic, thank you. So before we get started, I just wanted to tell you a little bit about our the policy of informed consent and confidentiality as well. So in terms of confidentiality, everything that you say within this meeting is going to be kept completely confidential unless there is concern that you are going to pose a harm to yourself or others, in which we'll have to get the proper people involved. But aside from that, everything will remain completely confidential, and we are going to let you know the risks and benefits of any treatments or interventions that we're suggesting, so that you have a full idea of what you think you stand to gain from anything that we're suggesting. Does that make sense?
Okay.
Great. Gotcha. So I'm going to be starting with the social work aspect. I'm just going to ask you a couple of questions about some of the things that I read in your patient log. So one of the first things that I would like to talk to you about is I saw that you were saying that you kind of lack some motivation with getting involved in exercise, and also are a little concerned about the affordability of being able to go to a gym. Does that sound right?
Oh, yeah.
Gotcha. So can you tell me a little bit more about that? What your current situation is, and what's kind of preventing you from having that motivation to do exercise?
Well, when you say my current situation, what do you mean?
So just things that are impacting your ability to possibly do exercise, or something along those lines where it's what you're currently experiencing and what you might want to be doing in the future, if that makes sense.
Well, I guess currently experiencing, I just don't feel like doing it as far as exercise is concerned, and the finances are just not available for a gym membership. That's just not in my realm right now.
Yeah, that makes a lot of sense. One thing that I did want to let you know about is there are a lot of agencies in the area that may have free exercise programs or exercise classes, if that's something that you'd be interested in, and the finances are kind of your barrier to getting that. So I could definitely provide you with some resources in terms of how to get involved in that. But then also you said that part of it's just that you don't really feel like doing it.
Right.
Would you say that that's related to your motivation at all in general? Are you having a hard time doing things maybe that you previously enjoyed doing?
Oh, yes. With all of these things, that all these health challenges that I have going on, it's difficult to motivate me or for me to motivate me. You
I
know,
can imagine.
moving is difficult because of my osteoarthritis.
Mm-hmm.
And even with my efforts to lose weight, instead of losing, I'm gaining. And
Mm-hmm.
it just doesn't promote even an emotional thought wave of get up off your rear end and do something.
Mm-hmm. I can definitely imagine how that might be difficult for you. Um, how long do you feel like you've been having this experience of not having interest in things that you formerly enjoyed?
Oh, I'd say over the past year or two.
Gotcha. And do you think it has an impact on your ability to perform like daily aspects of your life?
Sure.
Gotcha. Okay. Um, so one thing that I might recommend, if this is something you'd be open to, is there are also agencies in the area that have the option of one-on-one therapy. And there are different therapists that do different kinds of therapy, but talking to a mental health professional might be an option that could help you feel like you're kind of getting back on track with being able to do stuff that you enjoy and being able to have coping mechanisms to boost your mood and things like that. Does that make sense? Does that sound like something you might be interested in?
Sure, that might be workable.
Gotcha. So we can definitely refer you some resources and stuff like that. So you can kind of choose like what seems right for you, what kind of be informed about like what different kinds of therapy there are and different treatment styles. And then the one last thing that I wanted to talk about before I pass it on to one of my coworkers is I saw on your patient file that it said that you don't have an advance directive and you might not be sure what that is. Does that sound right?
Right.
Okay. So basically what an advance directive is it's a legal document that kind of provides like an outline of how a patient wants to be cared for in case something happens when they're not allowed to make or not able to make their own decisions. Um, so in case you were incapacitated in some way medically, it kind of just provides like um, a little map of like how healthcare professionals will guide your treatment. Does that definition make sense to you?
Yeah, I guess so. So
Mhm.
that somebody else can make a choice for me if I'm not able to, basically.
Yeah. So I would just recommend that if you're able to kind of get on making one of those and having that ready in case something happens. Again, there's also agencies in the area that provide assistance with that kind of thing, with obtaining legal documents and stuff like that. So we can definitely refer you to someone who could help you get that outlined and make sure that you feel confident in that document so you don't have to worry about that in the future. Does that sound okay?
Oh, yeah, that sounds like something to put on my to-do list.
Awesome. Yeah. So we can get you all these resources for different services, different agencies and stuff like that. Um, and we can help you figure out how to work these changes into your life, if that sounds good.
Yep, it does.
Great. So now I'm going to pass it on to Jackie, who is our occupational therapist, and she's going to talk a little bit about some of the pain you've been experiencing and stuff like that. Does that sound good?
Okay, sure.
Thank you so much.
You're welcome. Thank you.
Hi, it's so nice to meet you. I'm Jackie, and I just wanted to ask some questions regarding your daily life, if that's okay.
Okay.
Okay, so my first question would be, would you be able to describe your typical activities that you tend to engage in every day?
The necessities.
Yes.
Get up, prepare myself for work, and get out to do that work as best I can.
So when you're preparing for work, in regards to self-care, do you have any difficulties with like bathing, dressing, toileting, any of those?
No.
No? Okay. And then do you experience pain during any work-related activities or during any activities you engage in daily in regards to like osteoarthritis or the left knee pain that you were experiencing prior?
I experience pain almost all the time regarding the osteoarthritis.
Okay, all the time. And then what are you doing right now to manage that pain?
Well, I've increased the use of the uh, pain medication, the what is it, naproxen? Am I saying that correctly?
Yes. Yes.
So, and then, but that pain promotes the sedentary portion of my lifestyle
Right.
because it hurts.
Absolutely. Um, would you be willing to use like hot packs or some cold packs or things like that throughout the day and see how that would like decrease your pain? Just like even putting ice in like a Ziploc bag and using that, or like putting a warm washcloth or putting a washcloth, getting it wet and putting it in the microwave, just so like things that you can do at home.
Sure, that's I hadn't even thought about those kind of things. No, but
Yeah,
yeah,
and
that sounds like positive suggestions.
yeah, or even like a self massage if you're, and just note whether that's increasing your pain or decreasing, and kind of starting a pain journal if you'd be willing to do that as well. Where you can just take a notebook and kind of log when you're really experiencing pain and like what you could do to manage that
Hmm.
throughout the day. And then in regards to the sedentary lifestyle you had mentioned, you said the pain is preventing you from like getting up and exercising.
Yeah.
Okay. Is there a way that you could even like set a reminder on your phone just to get up and stretch, just to like move your body a little bit more?
Well, I guess I could do that.
Yeah, or even I have links to YouTube videos or blogs or such I can share with you, and different resources on like low intensity, short duration exercises that aren't really that like intense or strenuous, just to get your body moving a little bit more. Would that be
Hey,
something?
sounds like a good idea. Just hopefully I can execute it.
Yeah, no, absolutely. And I think that setting reminders, or even like, um, I had noticed in your patient log that you live with your husband.
Yeah.
If you could let him know, hey, every once in a while, or he can even participate with you. Just like, let's get up, let's stretch, let's exercise. Nothing crazy. Maybe even like 5 minutes extra a day.
Yeah, I guess so.
And then I had another question regarding your diet. How do you feel your diet is impacting your health?
Well, I'm sure it's impacting it adversely.
What do I noticed in your chart that you eat more red meat and not that many vegetables. Is that something that we could work on? Like adding a portion of vegetables to just one meal a day, or even like decreasing the red meat and going for something else like as an alternative?
And you don't want that vegetable to be French fries, right?
I would prefer it not to be, but if it is, that's totally fine.
Really?
Yeah.
I like that. I like your ideas.
Yeah. Once, like, just little small changes here and there, you'll notice like a bigger difference.
Okay. So let's see, you're saying cut out just maybe one portion of the red meat in a week and then add a vegetable
Yeah.
a day.
Yeah. Just once a
Okay.
day. If you can add a vegetable portion, that would be great.
Okay.
And my last question was in regards to some leisure activities that you engage in. I noticed that you had said before that you are kind of disengaged with activities that you used to find joy in. Would you be willing to explore different leisure activities, or what are some, or would you like to become re-engaged with the activities that you previously enjoyed, or both?
I'd say it might be wise to consider both because sometimes the recall of those things that I used to do is sort of aggravating because I don't do them anymore.
Yeah.
So maybe if I threw in something new, I'd be more likely to be interested.
Okay, that's definitely something that we can add some new leisure activities if you're interested. What are some of your interests?
Oh, I used to like doing puzzles and things like that. Mm, and it just hasn't been happening too much recently.
Yeah. Would you do them with other people, like with your husband?
No,
No. Okay.
no,
Would
it
you
was
be?
no, I won't do it by
No.
myself. No.
And that's totally fine. And even like changing the time of day that you do these activities, or whether you engage with another person or not, or even changing like the type of puzzle that you're doing, that can really improve your engagement in those activities if that's something that you'd be willing to do. Or like I said, you can even explore other activities or different puzzles or different types of games, crosswords, Sudoku, etc.
That would be possibly a good thing.
Okay. Okay, that's definitely something we can work on if you'd be interested in that.
Okay.
All right. Well, those were the questions that I had for you today. If that's okay with you, I'm going to pass it over to Megan, and she's going to have some questions for you as well.
Okay.
Okay, thank you so much.
You're welcome. Thank you.
Hello there.
Hi.
As Jackie said, my name's Megan. I'm a medical student who will be talking with you today with this lovely team. It is shifting gears a little bit. I kind of want to delve into some of the medical concerns that I saw on the patient chart, if that's okay with you.
Sure.
So I saw that for the past 12 years, you've had hypertension.
Oh, yeah.
Can you tell me a little bit about how that's being managed at the moment?
Well, I think it's in my chart that I manage poorly because I don't adhere properly to the meds.
Okay. Why do you think that is? Is there a specific barrier you've
You know,
found?
I can't tell you specific why. I just taking pills has always been a challenge for me, and doing that on a regular basis, you know, days getting up, brush your teeth, wash your face, and put some clothes on. But you're not raised to pop a pill.
That's true. So it's kind of a remembering to take it every day. That's some of the issue with that adherence.
Mm-hmm.
Okay. There are things you could potentially do, like you mentioned brushing teeth, getting dressed kind of being what you're trained to do growing up. I found that with other patients, if you place the pill you need to take by your toothbrush in the morning, take it as you're brushing your teeth. Sometimes that helps with just remembering it and building it into your routine so it becomes more of a regular habit, right? Because as you said, taking pills is not something we're really trained to do, and it's often one of the hardest things to do is remember to actually take it. But do you think that might help a little bit?
It might, and I guess even though nobody said it to me, I assumed I needed to eat first, and so that have may be a factor also.
That's true. It depends on the pill whether or not food is going to be good on the stomach. So that is a completely valid point. Also found that you can set it with your breakfast stuff. If that's easier, you bring it with your breakfast to the table, eat some of your breakfast, take the pill halfway through once you get some of this food on your stomach. And it's kind of another way to build it into your daily schedule. It doesn't really matter where you build it in, as long as it kind of becomes a habit. And I found that it helps to be consistent.
Okay.
If that makes
Good
sense.
point.
Yeah, because I see that you in your log, it's mentioned how you checked regularly your blood pressure. You had a home monitor system.
Yeah.
Have you brought that into an office to be checked recently?
The
The home monitor system.
Mhm.
Sometimes it helps if you're going in for just an annual checkup or something to bring in the machine with you so they can compare it to their system just to make sure it's accurate. But I would highly suggest continuing up those home monitorings. It helps you keep a gauge on where you're at, as well as is the medication working or does that need to be upped or changed?
Mhm. Okay.
Another thing I kind of wanted to discuss again on the realm of hypertension is possible medication changes. Some of the issue may be adherence, so I would like to try to see taking that pill regularly, does that lower the blood pressure on its own before we go adding another pill? Since I know remembering to take pills can be difficult. But down the line, one recommendation I might make is actually upping the dose of your pill a bit just to kind of help lower those blood pressure readings, as well as maybe adding something like a diuretic. So basically, one way that you get hypertension is having a lot of salt in your body. So a diuretic helps flush some of that out, which can actually lower blood pressure. And
Oh,
it's typically very minimal side effects, so it's often pretty well received.
except I
Would
have
that
except I have to stand by the bathroom.
actually, no, not typically. It won't be any sort of laxative effects where you're like, I have to run to the bathroom. But if you do find that, that can be something we mitigate down the line.
Okay.
Would a sort of medication change like that be something you're interested in trying after seeing how taking the pill consistently affects your blood pressure?
Yeah, I guess so.
Okay. If you have any sort of hesitations, like I said, I think trying to be consistent with the pill and seeing how that works first would be the first line before we go adding another.
Okay.
Additionally, as my colleagues have mentioned, diet does play a huge role in a lot of issues. So, as Jackie was mentioning, things you can do like limiting some salt intake might actually also naturally help the hypertension and things like that. So, kind of being aware of the salt intake and like if you do have those fries as your vegetable, that's great. Maybe just don't add extra salt on top. Could be a small little action you do that helps the hypertension a bit.
Okay, something to consider.
Yeah, just little changes as we all little changes add up every day.
Okay.
Since I do see the time, I am going to pass it off to Hannah just so that we can make sure we get all the important things tackled today. But
All
thank you
righty.
so much for
Thank
answering all the questions today. Oh, Hannah, you're muted.
I just saw that. Thank you. Hi there, Courtney. My name is Hannah. I'm also a medical student, and I want to just kind of continue the conversation about some of the medical concerns that you have ongoing. Right off the bat, I'm hoping that you can let me know how things are going with your diabetes right now.
Well, that's interesting because as much as I miss my pills for the high blood pressure, I'm very consistent with my diabetes meds and checking the monitoring the readings. So I work I guess, more consistently and diligently at that than I do the blood pressure business.
And I want to commend you on that because I know that's something that you've worked hard to do, and that's excellent to hear. Do you have any ideas why it might be easier for you to remember those medications and not the hypertension ones?
Maybe it's because not in my direct family, but others around me, I've seen so many of the adverse effects of diabetes and not interested in losing limbs or life.
Yeah, so you have a pretty clear understanding of you've seen firsthand some of the risks of that condition continuing on, it sounds like.
Yes.
Okay. Well, so it sounds like you're doing really well with taking your medication, and that's great to hear. Can you talk to me a little bit about what specific activities you're doing on a daily or weekly basis to monitor your blood sugar, and any other diabetic care activities that you're doing regularly?
Well, as I said, I've not missed a dose of my medications, and I monitor my glucose readings at random, but I do it. So
Okay.
that's what I do.
Okay. So then, as far as what you mentioned on the blood glucose readings, sometimes it can be helpful to have more of a schedule in terms of when you're going to monitor that glucose. And the reason for that is the more information that we have about your glucose on a regular, like daily basis, specifically around meal times, that helps us to know from a day to day if, for instance, there's a specific activity or a specific food that might be giving you problems with your glucose. Can you think of, just thinking about your regular day, is there a specific time of day that might be a good time for you to do a glucose check in your regular life?
Well, what I've been doing is typically before breakfast and then after meals.
Okay.
So is that what I should be doing?
Well, so that's a great place to start. So that would be 4 checks a day, right? You're doing one first thing in the morning, and then you're doing one after each meal. Are you able to manage that number of checks every day?
Yeah.
Okay. Well, I think that's a really great place to start for us, because what that's going to do is that's going to give us a check on your overnight sugar, make sure things aren't dropping too low overnight. And it's also going to give us an idea of how your body is responding after each mealtime. And so those are really the big areas we want to watch out for, is whether you're high after meals and whether you're low first thing in the morning. So I think if we can make it a goal to do those 4 checks regularly, do you use anything to write down those numbers or track those numbers over time?
Yeah. I have a chart that I try to follow.
Okay, so you've got a chart. If you're somebody who likes to use your phone to remember these kinds of things, there are some apps that can be used to log those sugars, and that makes it really convenient because, when you go in for a doctor's visit, if we want to look at those logs together, we're able to just pull that up, and you're not having to keep track of paper.
Okay.
So that's an option I can definitely share with you.
Okay, that
And then the
sounds
great thing about that is you can also, oh, I'm sorry. You can also program some reminders so that you don't have that mental load of trying to remember to do the check. Your phone will just remind you.
Mm-hmm. Okay.
Okay, so we've got a couple good plans there. Something that I heard you say earlier in our visit is that you're feeling like a lot of the health challenges you're facing are related to each other. Specifically, you mentioned that your osteoarthritis is making it difficult for you to make some of the exercise related changes that you're interested in making.
Right.
I'm wondering if you can let me know, with that in mind, the fact that you have some interrelated health challenges, in your opinion, is there a particular change that you think would have the biggest impact on your health?
Particular change that would have a biggest impact. Probably, I don't know if it's just one thing, probably the combination of
Okay.
dietary change and exercise change. Those, I think,
I agree.
in hand would
Mhm.
likely address everything.
I agree with you. I think you're absolutely right. And as you articulated just a few minutes ago, you're clearly thinking about the potential risks of some of these conditions, and it sounds like you're really committed to making making changes, especially knowing some of the complications of diabetes and some of these other health concerns. One thing I did want to discuss in relation to your diabetes is looking at your labs. I don't know if you had a chance to look at any of those lab results or if you had any questions about those.
No, we need to stop.
Okay. I thought we had 45 minutes for the visit.
Yep. As I understand it, a total of an hour. And so you could use up to a half an hour for your discussion.
I'm looking at the assignment right now. It says 30 minutes for the pre-visit and 45 for the visit. So maybe that's not correct.
Maybe I have misinformation. Somebody will cut us off if I'm wrong.
Okay, I want to make good use of your time. I don't want to waste your time.
That's two of us.
So as far as I'm sure you're a busy person. So if you're willing to go for another 15 minutes or 14 minutes, okay. As far as the labs, did you have any questions about those? Had you had a chance to look at those? Do you understand what those tests are for?
I understand what I'm looking at anyway.
Okay, that is completely understandable. So I'll tell you what I noticed in your labs, and maybe we can put this in some context. So most of your labs look pretty good. Your electrolytes are good, which is definitely a good thing. The one thing that really jumped out at me was some of the kidney tests. So as I'm sure you know, with diabetes, there are a couple things that we really want to keep an eye on. You mentioned one already, was the limbs, right? Thinking about foot care, thinking about monitoring your blood glucose, both of which you definitely already had some experience with. But another one of the complications that we really want to watch out for is kidney injury. And your labs are showing an increase in your albumin to creatinine ratio. And what that means is it's showing that your blood sugar and your diabetes is starting to have an impact on your kidneys. The good news is we're not in a place where we've got irreversible damage yet. We're kind of in a pre-risk state right now. So we're in a place where if we can take some action, we can start to reverse some of those concerns and get you back up to perfect kidney function, hopefully. But it is a cause for a little bit of concern because what these numbers are showing us is that we're starting to have some reduction in your kidney function. And so that's where some of these strategies that we had talked about before in terms of that blood glucose log and maybe using an app to monitor, and as well as some of the changes to medication that Megan was talking about. Specifically, that hypertension medication is really going to help with these kidney numbers and hopefully get those back up to a good spot. So do you have any questions about what I'm saying there or concerns?
No, I don't have any questions about it. The concern is my need for change.
Okay. So we talked a little bit about some barriers to making these changes, and I think we've got some good plans in place. We talked about accessing some resources to make it easier to exercise in terms of having an accountability partner in your husband, possibly getting access to some free workout classes so you're not having to try to motivate yourself all on your own, but rather you have something to look forward to in terms of a scheduled activity. We talked about making some changes to your medication for hypertension, and I think Megan and you discussed some strategies that might help with just remembering to take it. And then we talked about making some changes to the glucose monitoring as well. So I think that hopefully, with those things in mind, how are you feeling about your ability to implement some of those changes?
Well, I think that it's something worth working towards making the changes.
Okay. Do you have any reservations or is there anything that you think is going to prevent you from implementing some of those changes at this time?
Nothing but me.
Okay. So it sounds like we've got a good plan in place. We will go ahead and write down these things that we've discussed today in a document for you to take home so that you don't have to remember everything here. And then we'd like to follow up with you at your next visit.
Okay. Ooh,
See how things are going.
okay. I look forward to that.
We do too. Did you have any other questions for us today?
Not that I can think of.
Well, we appreciate your time. Thank you so much for coming in, and we'll touch base with you when we see you in a few months.
Okay. Cool.
Thank you so much.
Thank
Thank
you.
you so much. We appreciate your time.
Absolutely.
As I do yours. Okay.
Okay, and then we get to do our huddle here.
Yeah. Yeah, I was very confused when the 30 minutes popped up.
Ezra,
I realized I
pulled
muted.
up
I'm
the
sorry.
thing to look at the schedule because I was like, it's 45, but that's okay.
Yeah.
I thought we had a different.
I made another
didn't want to
document.
cause a conflict, but I was like, I do want to push back on that because we do have
Yeah.
45 minutes.
Just some really good points at the end and a nice closing.
Yeah.
Yeah, it's a very good closing. So I made this little table thing kind of based on the one that they gave us because I don't want to have the same problem of it autofilling. So I've started on it a little bit, but I guess we can just go through each of these and kind of put into words what we want the outcome to be and what we want the follow-up to be, or and anything in the intervention if I missed that.
Yep.
So do we want
And
to?
then I did just.
Oh, go ahead.
I did just put in the chat the stuff from Canvas as far as what we're supposed to touch on in the debrief also, so we can refer to that too.
Do you achieve your agenda? Well, what needs improvement? Blah, 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 blah. Okay, cool. How do you guys think it went?
I think we hit a lot of the points we wanted to.
Yeah, I think so too. Again, I feel bad that I was on the wrong case study, and I'm sorry about that.
That's okay, things happen.
Yeah, I feel like it's kind of hard sometimes when a lot of this communication is like through email and stuff like that. Because it's easy to kind of glaze over something on accident. But I think I was able to talk about most of the things I was concerned about. We didn't get a ton of time to talk about the sleep, but that wasn't one of our like top issues, I don't think. So that's probably fine. Do you guys feel that you got to talk about what you wanted to? Good.
I think.
Oh, go ahead.
I was just gonna say, I think one of my big, just based on like some of the modules that we've been doing lately, I think one of my big goals was to kind of let the patient lead the encounter as much as possible. And to kind of base some of my in the moment recommendations on what they were saying. And I think in this case, it's a little harder when it's a standardized patient rather than an actual patient, because, an actual patient is going to have a lot more opinions and ideas and thoughts about how things are affecting their day-to-day life. And, standardized patient, just because it's, it's not their own health that they're talking about, they're going to have to make stuff up on the fly, which is a lot harder. So
yeah, definitely.
That's a little different there.
Yeah. Yeah, I totally see what you're talking about, because they're kind of just going to be like, yeah, sure, to whatever recommendation you make, because they're not, I mean, it's not like they're not allowed to be like, no, I don't want to do that, but like, they don't want to make it too hard for us. So, am I still sharing? Can you guys still see this?
All good.
Okay. Does anyone else have any comments they want to share about how it went, or do we want to go on to filling this out?
I think we can move on to filling that out. Okay.
Okay, cool. Yeah, so if we just want to go across for each concern, and you can just tell me what to write and I'll fill it in.
Yeah, so I can start with hypertension, and Hannah, feel free to jump in and add as I speak. I forget something. So goal is definitely just kind of lowering those numbers since they are high there. Interventions, yeah, try to adhere to medication doses, incorporating into schedules and kind of making it a routine, as well as reevaluating the blood pressure after that change. Just since taking the pill was kind of one of the barriers, we don't want to add a second one in and make that even more difficult. We rather see how that change impacts the patient first. And we can even increase statin dose and then see how the adherence goes in, just so that we don't want to keep that high of a blood pressure for a long period of time. So we want to address that as succinctly as possible. Yep, changing medication, increase statin dose, potentially add a thiazide diuretic in at a later date.
Is that how you spell it?
Let me see. Statin.
Okay.
And then add thiazide, so diuretic, yep. As well as it's a small little thing, but bringing in the home monitor. In some of my clinical experiences, patients have brought it in, and it needs to be recalibrated. It has been giving them completely wrong values. So just getting that checked at the next possible visit is always something I recommend. So
especially because her numbers weren't that high, but she's got end organ issues with the kidneys, which makes me wonder if it's calibrated right. So that was a good thing.
You want to check that in. Make sure that everything's good. Yeah. Monitor, bring it in, compare numbers. I also loved the idea that you had, Hannah, about the app to record glucose numbers. I think she could easily find something for her blood pressure readings as well as little reminders.
Probably one app can do both.
Honestly, yeah, a little health recording app. Because it's also, it's
honestly, the iPhone one does both, just built in.
Oh, there's a built-in one. See, I don't have an iPhone, so I don't know.
The Apple Health app, I believe, does both.
Yeah.
Wow.
There you go.
Well, I think that's great because it always helps to see the numbers in sequence when you're in office, like from week to week. Is it getting better, especially if we up the dose? So the statin, we want to see if that's working. So comparing early numbers to once the statin's taken effect. But those would be my major points in hypertension.
Wonderful. So how would you like me to word what the goal is for the diabetes treatment?
So we've got several goals here. We want to get the HbA1c, so HbA1c, down. Right now it's 7.8. Ideally we want it below 6.5. That's going to be quite a journey. So I would settle for it being lower because it's looking at the patient's history, it's been trending up for like a year. So that's a big one. We also want to get the fasting glucose numbers down below 100 consistently. And we want to get the postprandial glucose numbers down also. I think for that, I think the management goal would be, I think I want to say that the goal really is to complete 4 daily blood sugar checks so that it's something that's really measurable, and to keep a record of that so that we can, basically what we want to do clinically, and this doesn't need to go in the document, but what we want to do clinically is to be able to compare the A1C numbers to the glucose logs and see, okay, where are we going off track here, basically.
Gotcha.
And then I think the other major goal for the diabetes is to increase, or rather to decrease those kidney numbers. So improve the kidney function tests. And that's going to be kind of a combination of hypertension and diabetes management.
Yeah, I was going to say that could easily also be copy and pasted into hypertension, as well as adherence to medication. I realized is a major goal in the hypertension.
Cool.
So
what
I
are we
think
thinking
for the
for this
intervention? Yeah, let's change that to glucose monitoring 4 times daily.
Okay.
Just to make it really concrete for the patient.
Yep.
And then what else do I want to do? At next office visit, review glucose logs and A1C. And consider adding a GLP-1 agonist. So it's just the letters GLP and then the number 1, and then the word agonist, which is AGONIST if you're not familiar. If A1C continues to be high. And then kind of the third thing would be monitor blood pressure readings and review at next office visit.
Alrighty. And then
so we talked about the app to record glucose and remind for glucose checks. I think for the rest of the follow-up, I think we can just copy paste the intervention as far as where it says review the glucose logs. Basically the rest of that whole column we can just kind of copy paste over.
Okay.
Basically the plan is we're going to monitor the glucose better, and then we're going to work on the diet. Oh, let's add diet to the intervention, diet and exercise. And then we're going to check in at the next office visit and see if those are doing what we need them to do.
Alrighty.
Hi, this is Chris with the Cato staff. I just wanted to check in. Did everybody get enough time with the patient? Did they already moved on to the next call?
Yes.
We
Okay,
did. Yeah, we just were concerned because we didn't, she was thinking it was half an hour and we were told 45 minutes, and we didn't want to take advantage of her time, but we also wanted to make sure we had enough time to complete the assignment.
No, I appreciate that. We had that clarified. It was a half hour for prep and 45 for the encounter. Our meetings are only scheduled for an hour. I think that's where the confusion was. But it basically is the way we have it set up is our patient can go over that time if need be. But if you guys are all set, I'm going to back out and let you finish.
Thank you.
Yep.
Okay, thank
have a good
you.
day.
You too.
Okay. So what shall we put for diet and exercise?
Well, increase exercise and basically we want to reduce like her sedentary lifestyle, and then like making her diet just more nutritious, I guess.
I'm gonna nitpick a little here.
Oh, God. I don't know.
I think for the recommendation, we should try to quantify it. Because if we have a number in there, it's going to make it easier for the patient to implement, and it's also going to make it easier for us to check in and see, what actually happened and how did that impact the patient. So if we're saying increased exercise, how much and how are we doing that? Like, does this mean the patient needs to exercise for 20 minutes 3 times a week? How are we going to quantify that for the patient?
Yeah.
What you just suggested sounds fine to me, but
I think maybe
That's
start with
fine.
like 5 minutes, like
Yeah.
Jackie, you suggested, just due to the osteoarthritis, and then increase as she sees is appropriate.
Yeah.
Additionally, for like incorporating more nutritious options, 1 serving of vegetables per day, as well as limiting additional salt intake, because that can also play a role in hypertension and things like that. So adding
gotcha.
some very specific details about that will help her to know exactly what to hit and what she should be aiming for.
Mhm.
Did you say
And I
one
do kind of
vegetable
have those
serving
in
for a
here. So.
day?
Oh, per day?
I feel like we should go for per day.
Yeah, per day. Yes, per day.
Especially if our strategy is to adjust and then check the labs in 3 months. If we're only adding 1 vegetable a week, that's not going to produce the movement that we need.
Is this
And
looking
then
right?
just like I mentioned, I know you wrote possible exercise class, but also just like doing home exercises, like just like even like through YouTube, just like a low intensity, short duration, like even like a 5 minute like exercise at home with her husband, without her husband. She can set reminders on her phone if she doesn't remember to exercise, just like literally like just on her clock app, like just like reminders, and then exercise for 5 minutes. And then like, yeah, including her husband as like an accountability resource. What else?
And how did you say that you wanted to like follow up with that about like the changing diet things? Like how would you measure that?
Well, I would just ask her when the next visit, like, have you made the changes? Like, are you having like barriers to making those changes? Like, what can we do? Now, if she did make the changes, okay, so now like can we add another one like per day? Like it was just kind of depend on where she's at, I guess.
Gotcha.
In terms of monitoring, that's also something, since we have a really concrete goal of 1 vegetable a day, it would be really easy to just put a checkbox on the app that she's using to monitor her other health issues. Just, did you get your vegetable today? And then, when it's time for your visit, then you can pull it up and see, okay, over the last 3 months, you managed to eat a vegetable 80% of the time. That way, you get something more. You're not just relying on memory. You're able to kind of look back at the data, and that might, if I know that for myself, like if I can see that data, it's a little more, it gives you a little more impetus to really push through and make the change, because you're going to write it down. Right.
Alrighty, are we good for that row? Are we good to move on to the next one, or anything else for that one?
That's fine.
Okay.
Yeah.
Let's move on to the pain then. So probably the goal would be reduced pain, right?
Yeah, definitely we want to reduce.
And I would say reduce NSAID use too, which if you reduce pain, hopefully you would also reduce NSAID use.
Mm-hmm.
What was that? I'm sorry, I couldn't hear you.
NSAID and SAID, like non-steroidal anti-inflammatory drug. Especially with her kidneys not being great.
Gotcha, that makes sense. Were there any interventions for that I missed?
I just said like doing a self massage as well, like
yeah.
Hot cold pack, self massage, pain journal, and then with the pain journal, just like noting when she's experiencing like the most pain. That's like pretty much what the pain journal like has to do with.
And then I guess just like keep track of when highest pain is experienced, follow up at next office visit. Is that right?
Yeah, I mean, yeah, I guess that's fine. Yeah.
Is there anything else that you'd rather say?
No, that's,
Okay.
I mean, yeah, we're gonna just like track her pain, see when it's the highest, and like make adjustments accordingly.
Cool. So then I did this. Let's see. I'm trying to think if there's any other. I'll say increased motivation as well. And then follow up would be check on duration of symptoms at next office visit. Ask about ask patient if they have been good therapist. Um, hmm. So there's basically like, I don't know if you guys have ever had to do these before, but there's like tools that mental health professionals use that are like, in the past 2 weeks, how many times have you experienced like this symptom? So that's what I mean by like the anxiety and depression inventories, because once you get a score for anxiety and a score for depression, it kind of shows you like, is any of the things that we've tried to implement working? Do we need to think about a different intervention? Like, where do we go from here, essentially? And I'll just say talk about coping mechanisms in daily life. Yeah, so
for the intervention, sorry. For the
yeah.
interventions for depressions, do you mind writing like re-engagement with leisure activities that previously brought them joy, as well as exploring new leisure activities that they might possibly enjoy?
Yeah. Yeah,
Thank
that's
you.
great.
And then there's an additional section for the patient care plan that we also need to do.
Oh, is there? Okay.
Yeah, we have that. There's a healthcare disparities thing.
Oh, that's important.
Yeah, so I will.
Here, I'll make another table.
Yeah, that's what they did in the thing. It was just a second table.
We're also going to need to write out a reflection that we discussed just verbally, put it on paper just to kind of identify if we feel like we were able to accomplish the agenda.
Yeah.
All those things.
Is that a group project or is that individual?
It's in just the IPTV assignment along with the patient care plan. Was it individual?
It does say one submission. We didn't do that last time.
Okay. And the reflection.
So it looks like it says there should be one submission per team. Yeah. So I guess that then that's a group reflection.
Yeah.
But if we don't have time to complete it all today, I can like share this document with you guys and we can kind of just type it up in the time that we have, if that makes sense.
Yeah. Oh, it's too much.
Preference would be to knock it out today if we can, but
okay,
I understand if people have other commitments.
I just didn't know if they were like gonna kick us out of the room when it hits 9:30.
Yeah.
Let's see, what am I doing?
Do people have like places they need to be soon?
I'm gonna need to head out soon. I'm heading up north, so I need to get driving soon-ish.
Yeah. I'm going up north tomorrow, so that's why I want to do it today.
Yeah.
Yeah, I understand.
Where are you going, Megan?
So UP, Marquette, Duluth, and then circling around to Wisconsin, Chicago, all the way back.
Sounds fun.
To the UP also.
I'm very excited about all that. I've never been that much in the UP, so.
Oh, it's cool. Get some. There's a good pasty place on Highway 2, like just like 2 or 3 miles to the west of the bridge. So.
Okay, I'll take note of that.
Okay. Financial barriers to exercise.
Financial barriers to medication.
Yeah. Would you say that not knowing how to like get your advanced directive would be considered a healthcare disparity?
Yeah.
Okay.
It's she didn't know what it was, so it's kind of it's hard to understand medical information. And so
yes,
kind of
definitely.
Healthcare literacy and understanding, that's definitely a disparity.
I think, maybe if we change that to healthcare literacy, because I think that, that would also encompass, understanding the significance of the lab tests also.
Yeah, that's
which would kind of feedback on adherence and self-monitoring too.
Yeah. Is there anything else you guys would add to the exercise one?
No, using just the reminders, I guess, on the phone.
Yeah. Okay. What do you guys think about the financial barriers to medication? Aren't there like, they always say at the end of those like medication commercials, if you can't afford your medication, whoever might be able to help.
So, I mean, I think the big thing there would be to explore their healthcare coverage. You know, are they eligible for Medicaid? Are they currently enrolled? You know, there's a huge number of people who are eligible but aren't enrolled, and that can really reduce medication costs.
Yeah.
And then I
Getting
think
them
the other
enrolled.
option would be, you know, sometimes if you're trying out a medication, especially since we've proposed changes to several of her medications, we might be able to provide some samples, which would be free to the patient until we know whether the medication is going to be effective. I know that that's what my CEC physician did.
Same. It's very helpful. Patients love it. It's convenient.
Yeah.
Anything else for that?
I think just beyond just currently enrolled, talking specifically about like barriers to enrollment, helping them through that process, which also goes into healthcare literacy. A lot of those coverage plans use a lot of jargon that's not overly accessible to even healthcare workers, let alone patients.
Yeah. I truly feel that they try to make it more difficult
than it needs to be.
Yeah. And it negatively impacts a lot of people. Let's see. Because like I know some social work agencies even have like insurance experts who can help you walk through the like the process for applying. So maybe talk to an insurance expert at social work agency.
I think that there are also resources similarly for the advanced directive also.
Yeah.
There's also a lot of free legal clinics. My parents are both lawyers.
Nice.
There's a lot of, basically every law school has a free legal clinic, and that's the kind of thing that they'd be able to help out with because it's pretty easy to document.
Cool.
Also, as for that reminds me about the healthcare coverage, a lot of the free, at least Wayne, like free student clinics will be able to help you set up that coverage plan just right on spot. They'll be able to connect you with that.
Yeah. And there's also, speaking of that, there's free dental clinics. I mean, there's at least a couple associated with Wayne that do free dental screenings, and especially since that had been a barrier for this patient, we didn't really talk about.
Yeah. So is that like medical
and if
students?
Any of you don't have dental coverage, you can go get a free teeth cleaning.
I did not know that. That is so interesting. I did not know that.
That's great.
Beyond helpful.
The clinic is on Woodward.
Sick.
And the dentist who does the screening, she's awesome. She's so cool.
Hell yeah. Are there any other disparities that we can think of, or are these the major ones? I think
those are the major ones I'm thinking of.
Yeah.
I think we encompass a lot of issues there.
Yeah. So then what's the last thing that it says?
Can we just glance through the agenda real quick and make sure we hit everything since we had to kind of make
I remembered that we gotta write down Jackie's recommendations one more time because when we were trying to do the like fillable PDF, they got deleted. So
I think they're in the chat. I like wrote them out. Like,
Are they? Okay.
I don't know if you saw that. They're
So,
like,
and then for the 3 to 5 biggest concerns, we're supposed to also include the recommendation there.
Oh, okay.
Which honestly, I think we covered in the other document, so we could probably just copy paste it from the patient care plan.
Yeah.
Also, did we do role and responsibility in that agenda?
I have the order down
Kind
here. Is
of.
that what you mean?
That was the order that we worked out, which would be kind of the role and responsibility. We just called it something different.
Maybe we can just title it like role responsibility, and that I think that encompasses it.
Yeah. Agree.
Sorry, I'm just trying to format this.
yeah, sorry, I don't know why it went like that in the chat.
Stuff happens.
Also, this is totally just while I was writing. So you're talking about all the cool things that Apple Health can do. If you have an Apple Watch, it can do an EKG.
Really?
How valid is that? I have many questions
my
about it.
CEC doc. I mean, it's not as accurate as an in-office EKG, but if you're trying to do like routine cardiac monitoring, it can be a really cool tool. My CEC doc uses it all the time, and he's like always telling patients about it. So it's pretty cool.
So funny.
Things Apple can do, I swear.
Okay.
I mean, a wrist-based heart rate is not as good as the leads on the chest, but it is better than zero monitoring. So
it's something, right? We'll
Yeah,
take something.
true.
Okay. I think that's all well and good.
and can we retitle from order to roles and responsibilities just so that it's clear? Check that box.
And then maybe under my and Hannah's section, just be like address some medications as well as medical concerns.
Yeah.
And for the 3 to 5 recommendations, I think we probably just want to copy paste because we were supposed to have the recommendations on there too.
Oh yeah.
So I think maybe just copy the intervention / Rex column.
That seems good.
I don't know if your guys' experience is like this, but I know that for the med school side of things, like when you get a rubric, they really want you to do exactly what's on the rubrics.
Yeah.
I think that's why Megan and I are coming from.
The little words count, and they count against you.
Yep. One time for CEC, there was an assignment where we literally had a template that we were supposed to fill out and submit, and I got a comment that I didn't do something that the reviewer wanted to do, but it wasn't on the template.
Bruh.
I think I got the exact same comment.
That is not.
It was an M4, and I was like, girl, you don't understand the assignment here.
Yeah, no, please give me a break, please.
Like, I'm sorry, but if they wanted that, they probably should have put it on the template.
True. Okay. Is that good? So now We got all those. And then, if we want, like, since I know some of you have to go, I can just I'll paste these questions in there. If you guys just want to type up a quick answer, I can then just incorporate them.
Do we want to make the reflection a separate document just so that we can say like boom,
Sure.
boom, boom, 3 requirements, 3 documents?
Yeah, sometimes it helps if they see the separate attachments.
Yeah.
Yeah.
I foresee them saying you didn't do the reflection, and we say it's at the end of the patient care plan, and they say they've made my groups resubmit assignments before for stuff like that. So
Constantly.
I don't know if you remember there was a service learning project where if you didn't use the template PowerPoint, you had to resubmit it because they wanted it to have the Wayne background.
I was like, do we really need the Wayne background that much?
Yeah, ours looked better, but okay.
But we'll fit it all on this little card.
I feel like we could probably knock this out pretty quick.
Yeah.
Yeah, I'm not worried about it. It's short questions.
I think for advantages and challenges, I'm not sure, Ezra and Jackie, have you guys had the chance to be in clinical settings in part of your program yet?
Mm-mm. We don't get to do that really until master's program in social work.
We did it.
Megan and I have had some.
No, I was there for 1 week and it was just observation. So not really.
Yeah, because I think that's kind of with just like how this assignment is set up, I do think that because Megan and I have some experience with longitudinally being in a clinic over many, many months, I think that changes how we're looking at some of these things because we've, talked through these things with real patients. So, and I guess varying clinical experience.
Yeah, no, I agree. Because we don't even do anything long term until June. That's it. We do a week of observation in the fall and then a week in the winter semester. And then this June, we'll start actually doing things.
Exciting.
Yeah, we don't get to do it until master's, which is so stupid. But, it is what it is.
Yeah. We had a year where we went this past year every other week. Every other week, I believe.
Every other week. Yeah.
Yeah.
Wow.
So it's a solid experience.
For 4 hours or so, half a day.
It's usually
That's so nice. I like that.
It is and it isn't because you have all of your other responsibilities, but I do feel like it. Honestly, I liked it. It just there was a lot of bullshit assignments that we had to do that I didn't enjoy, but the actual experience I think was really useful.
Actual patients, wonderful. Little assignments, less wonderful.
Stupid.
That's why I'm so excited for rotations. I'm so excited for those.
Yeah, same girl. I can't wait. What are you starting on?
Surgery.
I'm starting on internal med, so I hear you.
Oh, but I wanted internal med first. I've heard that's a great one to start with because it's the basis for everything.
That's what I wanted to start with because we just did STEP. So I was like, well, it's fresh and I want to know this stuff before I do everything else. So.
Yeah, I didn't want surgery, but it's what I have. So I'm going to make the most of it.
I'm sorry.
No, it's okay.
What site are you at?
Henry Ford, at least. So.
Me too.
I hear they have a fantastic surgery program there.
Yeah, I'm real excited about the surgery at Henry Ford. A friend of mine is a fellow. Okay, so how do we optimize our ability to function? I mean, I think we divided up tasks pretty effectively.
We also discussed where the overlap was.
Yeah.
Planned ahead.
Yeah, so we weren't repeatedly hitting the same points, except for to emphasize.
And what was the second thing you said? Divided tasks evenly and something else.
Made
discussed
sure
how
to
they would
discuss
overlap.
Oh, thank you.
Yep.
Um,
I'm gonna be right back.
okay.
Mm-hmm.
Um,
Yeah, the time was interesting, but she was like, all right, you're done.
yeah.
That put me off real fast. I was like, okay, Hannah's gonna have 6 minutes to talk. I should stop.
Yeah, I didn't know. I thought it was 45. That's why I was like,
It
okay.
is. Yeah. It happens though, you know. Also, if she budgeted for only an hour, I didn't want to push that extra 15 minutes if she had to get somewhere.
Yeah. Because I think she was,
Yeah.
ready to go.
Makes sense.
Yeah,
Can't
I
imagine how
mean,
many visits they have to do.
yeah.
What lessons did we learn, friends?
And I learned a lot about your guys' specialties that I didn't know.
I
That's
was gonna
my
say
main
the
lesson.
same. Yeah.
Yeah, like the different things available to patients. I mean, that's great, especially for us to know, just to be like, hey, we can connect you with this specialty, and these are the sorts of resources they can talk to you about. It's always
Mhm.
helpful to know that.
Yeah.
Yeah, I think definitely like knowing who's on the team and how to utilize, I think that something that comes up a lot as a problem in healthcare is being too siloed, and like we know our specialty really well and we don't really know anything outside it. And so I think that
Yeah.
just like being aware of like what's out there and like who we can, actually knowing the people who are doing these other things as human beings, and like, knowing such and such a patient's going to get along with such and such social worker, and so we should hook them up, that kind of thing.
Yeah. What else did we learn?
Do we want to like number bullet these since they're saying a minimum of 2?
Sure.
It could be like 1, 2.
Make it easy for them to give us
Yeah,
the point.
here you go. No questions.
I used to be a teacher, and so I know that when you're grading 100 different things, sometimes it's easy to just be like, boom, boom. I would never do that when I was grading, but other people are lazy.
Mm. Mm.
Yeah, I think that's a really good one, Ezra.
Thanks.
And I mean, just
I'm
being
also just
aware
trying
that, like,
to own
these
up to the
things-
fact that I read the wrong case study. So,
I mean, I think maybe like differing expectations from people in a group prior to, I don't know how to word that, but like
yeah.
everybody coming into a group has different information to start off with, and so there's a period where you have to get on the same page, I guess would be a way to say that.
Mhm.
Yeah, that's a great point.
And that's going to be true no matter what. Like, I'm going to go with a lesson number 3 of just
Hell
like
yeah.
manage, just because if we have 3, then it makes us look good. Just learning about managing a telehealth visit and, navigating letting the patient talk versus us talking, and how to handle it when 2 people try to talk at once.
Yeah.
That is a huge thing. It's so easy to read body language in person, but especially I haven't used this platform often. I'm much more of a Zoom person.
Mhm.
Yes.
So I feel like there's
I
a
hate
delay, but I
Teams.
don't know if I don't know if it's actually there or just in my head.
There was a definite lag in some parts of our meeting.
Yeah, mine too.
Good to know I wasn't the only one.
You're not alone.
Do you think we need to like, is there any format we're supposed to put these in? Or is it just?
I mean, I think we've basically, I know I was referencing the templates we were given for these, and I think we've met the format requirements here.
If I do this, let's see. Okay, it does say it counts for everyone in the group.
Yeah.
So does everyone feel? Go ahead.
Do we think we should PDF them just for formatting?
Yeah, that's what I was gonna do.
Okay. Cool. Yeah, no, I'm good with you submitting those, Ezra. Is everyone else?
Thank you so much. And thank you for being scribe, by the way.
Yes.
Of course.
A lot of work.
Thank you. It's a big job.
It's kind of like helpful to me, honestly, because if I usually like fidget and stuff like that if I don't have something I'm actively doing. So like, it's actually helpful for me to be the scribe because it keeps me on task.
Yeah, it makes sense.
Oh, that's not what I meant to do.
I didn't know you could just drag files like that.
I was literally
I've wasted so much of my life.
See, we've learned something. That's our fourth lesson.
So much.
I would add that's my personal reflection.
Learned how to use Canvas better. Okay.
Yes.
Are y'all
I feel like
good
that's
with
the
me?
thing that's not going to work on a Mac.
Oh no, I have a Mac.
You do?
Yeah, this is a MacBook. I was doing it on MacBook.
Oh yeah, that is a Mac. I can clearly see that now. I'm looking at the bottom of your screen.
Okay, is everyone cool with me submitting this?
I'm good.
Yeah, looks good.
Yep.
If it'll go through, please. Yay!
Confetti.
We got some butterflies this time.
Nice.
Well, thank you all. It was really nice to meet you guys. Thank you for being so gracious about my confusion. Because I never want to be the person that's like unprepared. So thank you for understanding. Yeah, thanks for collaborating. You all did a great job, and good luck with your future studies. You got this.
You as well.
Yeah.
Yes, you guys too.
Thank you so much.
Likewise.
Thanks.
Bye.
Have a great one.